So erythrocyte inclusions. First is Howell-Jolly bodies. They are formed by the DNA. So they are nuclear remnants and formed by either karyorrhexis or incomplete nuclear expulsion. They are medium-sized, round, cytoplasmic inclusions, and they stain purple. Because they are nuclear remnants, they will stain similar to the nucleus. So they will stain purple on the our routine staining. They are non-refractile. So how to distinguish from the stain deposits? Just adjust your fine up and down. The stain particles, they will be refractile, but these Howell-Jolly bodies, they will not be refractile. They are regularly seen after splenectomy or splenic atrophy. I talked about the features of hyposplenism or splenectomy, target cells, acanthocytes, Howell-Jolly bodies. All these things, they are found in cases of when your spleen is functioning not properly. There are normal findings in neonates due to splenic immaturity. That's why we commonly find them. The spleen is not mature enough to remove these. And usually they are only few in number. But in cases of celiac disease, you will find numerous. And in case of megaloblastic anemia, which is associated with, normally in megaloblastosis, you will find some Howell-Jolly bodies. Normally megaloblastosis doesn't have too many Howell-Jolly bodies. Only a few here and there will be there. So the second erythrocyte inclusion is Pappenheimer bodies. These are composed of iron. Howell-Jolly bodies are composed of DNA. So these are smaller than these Howell-Jolly bodies. They are basophilic and ranging from light blue to black. Howell-Jolly bodies, they look like similar to the nucleus. The purple stain is there. These instead these Pappenheimer bodies, they appear from light blue to black in color. They're usually multiple. Howell-Jolly bodies, usually they are single or maybe two, but in case of these Pappenheimer bodies, multiple and irregular shapes are there. Howell-Jolly bodies are usually round in shape, and these focal clusters, there can be clustering, and they are usually found at the periphery of the cell. Again, Howell-Jolly bodies can also be found at the periphery, but they can be found anywhere. While these Pappenheimer bodies, they are usually present at the periphery. They are composed of hemosiderin. So their presence indicates sideroblastic erythropoiesis as well as hyposplenism. So any inclusion that is there, spleen is there to remove it. And when the spleen is not there, you will find the increased number of these inclusions in your peripheral smear. So if a cell has both Pappenheimer bodies and punctate basophilia, then you can use pearl stain to differentiate them, because these Pappenheimer bodies, they are composed of iron. The third, you must be wondering why I'm not showing the images. I will show them together so that you can make out the differences. So basophilic stippling, this is composed of RNA. So Howell-Jolly bodies, DNA, Pappenheimer bodies, iron. Basophilic stippling is composed of RNA. And there are numerous bluish granules distributed throughout the RBCs. Pappenheimer bodies are at the periphery. These basophilic stippling, it is throughout the RBCs, and they are pretty small. They may be faint and require up and down focusing to actually visualize them. And they are indicative of disturbed erythropoiesis. Okay, Howell-Jolly bodies and Pappenheimer bodies, they indicates hyposplenism usually, but these basophilic stippling is an indicative of dyserythropoiesis, and it is seen in thalassemia major and minor, megaloblastic anemia, hemolytic anemias, liver disease, dyserythropoietic states, and unstable hemoglobin. The list is actually long. I have included only the most common ones. Okay, the cases of these heavy metal poisoning, lead and other heavy metal poisoning, you will find coarse granules. Normally they are like fine granules, but in case of these heavy metal poisonings, the granules of this basophilic stippling will be coarse. So if you are seeing many cells with coarse basophilic stippling, consider these heavy metal poisonings, arsenic, lead, etc. Yeah. So this basophilic stippling is prominent in pyrimidine 5 nucleotidase deficiency, because this enzyme is required for RNA degradation. So if its deficiency is there, obviously the basophilic stippling will be increased. So these are the 3 images showing different type of RBC inclusions. First image is showing these Howell-Jolly bodies. You are seeing that this background is of megaloblastic anemia. You are finding these macroveilocytes and teardrop cells, and some schistocytes, that fragmented RBCs also, spherocytes are also there. So this is one, and this is another. They stain similar to the purple in color, similar to this, medium sized. Okay. So these are Howell-Jolly bodies. The second image is of basophilic stippling. The two cells showing different kind of, one of them, this on the left is showing this fine basophilic stippling, and on the right it is showing the coarse basophilic stippling. The third image is of a cell showing, this was taken from a case of thalassemia. The Pappenheimer bodies are there. So this patient also had autoimmune hemolytic anemia simultaneously. So, but you can see there are multiple, they are like light blue to purple in color, and they are arranged at the periphery of the cells. So this is the difference between the Howell-Jolly bodies and Pappenheimer bodies. I will just repeat it once more. Howell-Jolly bodies are composed of DNA, basophilic stippling is composed of RNA, and Pappenheimer bodies, they are composed of iron. Okay, so the another type of RBC inclusion is Cabot ring. We were taught that this was an artifact. Yes, this is an artifact, but this also indicates this erythropoiesis. The rings are actually formed by the remnants of microtubules that form the mitotic spindles. So they may take a form of a circle or a figure 8. And like I said, they signify this erythropoiesis. This is an image of a cell showing, this is a polychromatophilic cell, and here you are seeing this nice Cabot ring inside there.